Hello, and welcome to this webinar about navigating the aged care system. We are delivering this session on the lands of the Wurundjeri people and would like to acknowledge the traditional owners of these lands and of those wherever you may be located. I'd like to pay respects to elders past, present and emerging, and any Aboriginal or Torres Strait Islander people joining us for today's session. No doubt many of you are familiar with some of the challenges that older people can experience when accessing aged care services. So we'd like to start off the session by reflecting on some of these experiences, which in turn remind us why navigation supports for the aged care system are so important. The aged care system is complex, and not everyone is able to navigate their way to a successful outcome on their own. People will and do experience barriers when navigating and trying to access the services they need. For some communities, experiences of disadvantage, exclusion, or discrimination, whether recent or in the past, will lead to a reluctance or an unwillingness to trust or engage with aged care services. For others, language, literacy, health, or capacity will impact and may limit their ability to engage. Amongst the people and groups identified here, many will fit within the special needs groups identified in the Aged Care Act 1997. Creating an environment and system where all older people can access information and supports that enable them to make informed decisions and choices about their care and service options is critical. It's all about equity of access, providing information in a way that is accessible and meaningful to each older person, assisting people to communicate their needs, helping people to understand and interpret information and processes, whilst building knowledge about the service options available and building the older person's confidence so that all older people feel that services understand their needs and respect their preferences. As discussed in the video, navigation services are important because they enable those who are unable, unwilling, or reluctant to engage with the aged care system to access information and supports in a way that's specific to their needs. Whether that be assistance to build their knowledge of or confidence in using the system, whether it's about communicating their particular needs and preferences, or to seek assistance to understand and interpret information and processes. All of these navigation activities are important because they enable older people to make informed decisions and choices about their own care. So let's have a look at how navigation services have evolved.
Those of us in Victoria will remember back in 2013, the then Victorian Home and Community Care Program introduced the Access and Support Program to improve navigation of the HAC service system. So providers in Victoria will certainly be very familiar with this program. It's really well integrated within the service system, and of course it continues to have a strong presence locally. Following the transition of HAC to the Commonwealth Home Support Program and the introduction of My Aged Care, a national legislative review of aged care identified the need for a face-to-face presence in the community for people who required extra support to access My Aged Care and the system more generally. In response to the recommendations made in this legislative review, the Aged Care System Navigator trials were announced. These national trials have been testing different ways to help people understand and engage with the aged care sector. The Royal Commission into Aged Care and Quality Safety also heard throughout its inquiries that aged care needs to have a much greater face-to-face presence. It recommended a workforce of care finders be funded to provide face-to-face support to help people navigate and access aged care. The Care Finder program was announced in 2021-22 budget as part of the Connecting Senior Australians to Aged Care service measures, and it will be delivered through primary health networks. Findings from the navigation trials have informed the design of the national network of care finders, which is expected to commence in January 2023. So let's take a big picture view of what this will look like. First and foremost, we've got senior Australians and their support networks. So we know that My Aged Care is the entry point to aged care, and older people can choose to initiate contact with My Aged Care by connecting with the contact centre by phone, by face-to-face interactions through Service Australia outlets, or online via the My Aged Care website or via a GP referral. But as we've discussed, some older people will require assistance to navigate these pathways. So from January 2023, supplementary intensive navigation services will be available via care finders and trusted Indigenous facilitators. Complementary specialist support will also be available through the Older Persons Advocacy Network, the National Dementia Helpline, and the Carers Gateway. So this session really seeks to improve your understanding of the Care Finders Navigation Program, which is expected to commence in January 2023. So we'll take a look at the objectives of the program, as well as the expected outcomes for older people. We'll provide information about the target audience for the program, the roles and responsibility of care finders, and the referral pathways that you will need to familiarise yourself with into the future. And finally, we'll look at how the Care Finder program links with the broader aged care navigation and service system. As mentioned earlier, providers in Victoria will notice many similarities between care finders and the Victorian Access and Support Program. They say imitation is the greatest form of flattery, and I think this speaks to the excellent navigation services that access and support workers have provided to older Victorians over many years. The National Care Finder program will replace the Victorian Access and Support Services, which will cease to exist from July the 1st, 2023. And we'll certainly talk through the transition of these programs later into the presentation.
The objectives of the Care Finder program are to establish and maintain a national care finder network and to support improved integration between the health, aged care, and other systems at a local level within the context of the Care Finder program. The Care Finder program seeks to improve outcomes for older people in the Care Finder target population, including improved coordination of support for those seeking to access aged care, an improved understanding of aged care services and how to access them, an improved openness to engage with the aged care system, increased rates of access to aged care services and connections with other relevant supports, and increased rates of staying connected to the services they need post-service commencement. When we think about the program's scope, care finders will help people to understand and access aged care supports and services. So how does the program define aged care supports and services? For the purpose of the Care Finder program, aged care supports and services are defined as those which are funded by the Australian Government through the Support at Home program, which currently includes Commonwealth Home Support Program, Home Care Packages Program, short-term restorative care, and residential respite. Also covered within the program's scope is residential aged care, flexible care programs such as the Transitional Care Program, and broader supports and services, for example, the Community Visitors Scheme or the National Dementia Program. Care finders will help clients to connect with other relevant supports in the community. This function will assist to improve outcomes for people in the Care Finder target population. This is particularly the case in terms of improved coordination of support when seeking aged care. Care finders will take a multidimensional approach when considering a client's needs and other relevant supports in the community that may assist the client to maintain or improve their psychological, emotional, and physical well-being, or to break down barriers that may impede their access to aged care. The types of other relevant supports in the community that a care finder may help a client connect with will vary depending on the circumstances and preferences of each person and the complexity of their needs.
Examples of other relevant supports in the community include health and or mental health services and supports, social services, housing and homelessness services and supports, or drug and alcohol supports, and community groups more broadly. Where appropriate, care finders may help a client to connect with other supports in the community before they assist them to access aged care. This recognises that other relevant supports may enable people to improve their well-being before they access aged care, or it may break down barriers that may impede their access. The level and type of assistance that a care finder should provide when helping a client connect with other supports in the community will vary depending on the complexity of the client's needs. For example, some clients may only need a referral or, where required, a warm handover to other support services, and other clients may need more intensive support to connect.
The Care Finder's service delivery principles are much like your own and will focus on the delivery of inclusive, person-centered care, demonstrating respect and responding to the unique needs, preferences, values, and life experiences of each client. The service and delivery principles also encompass the system and quality approaches that we would naturally expect to wrap around a good, inclusive, person-centered service model.
Eligibility criteria will not be developed as a one-size-fits-all approach does not allow for flexibility and discretion that might be needed to ensure that the support is available for those who need it. There is likely to be significant crossover between people in the target population for care finders and the special needs groups identified within the Aged Care Act. However, not everyone from a special needs group will need to be supported by a care finder, and not everyone who is supported by a care finder will be from one of the special needs groups. Care finders will complement, not duplicate, aged care entry points currently available, for example, via the My Aged Care Contact Centre or the website. Existing aged care entry points will continue to provide access to those who are able and willing to navigate the systems for themselves. Care finders will therefore specifically target senior Australians who need intensive support who would otherwise fall through the cracks. This includes people who are not yet receiving aged care services, as well as those who are. The Care Finder target population is focused on people who are eligible for aged care services, who have one or more reasons for requiring intensive support to access those services or to access other relevant supports in the community.
There are many reasons why someone may need intensive support. They may be experiencing isolation, but does have no competent person to call My Aged Care to find out family representative about aged care who they are and to set up an assessment on their behalf, or maybe who is willing or able to support them to access aged care services via My Aged Care. Communication barriers, including limited literacy. There could be difficulty processing information and making decisions. There might be resistance to engage with aged care services for any reasons, and their safety could be at immediate risk, or they may end up in a crisis situation. And as we've already discussed, there could be past experiences that mean that they are hesitant to engage with aged care institutions or government organisations. While it's envisaged that care finders will mainly work directly with the person who needs to access services, they may also, where appropriate and with the person's consent, work with the person's carer, family, or representative. providing they also need intensive support to interact with the My Aged Care, access and aged care services.
Care finders will provide specialist and intensive assistance to help people within the target population to understand and access aged care and connect with other relevant supports in the community. The functions of care finders will include assertive outreach and engagement, and this will require building rapport with potential clients and local service providers. It may involve support to explain and guide people through the assessment processes, including attending assessment discussions and helping people to understand the services and supports most relevant to their needs. It might include completing forms, meeting with providers to arrange services, checking availability, and attending relevant meetings. Care finders will provide a high-level check-in with clients on a periodic basis, and they'll follow up support once services have commenced. When exercising their functions, care finders will use services such as the translating and interpreting services, Auslands Connection, Indigenous interpreting services, and the National Relay Service. So what is the length of support that we would typically expect a care finder to provide to a client? We've created a short video to explain.
It is expected that a significant proportion of care finder clients will need 15 or more hours of support from their care finder over a year, and some will need considerably more. This includes time associated with assertive outreach, engagement and rapport building, travelling to and meeting with the client, and indirect support, such as background research on potential providers, services, and travel time to the client's home or preferred meeting place. The degree of involvement by the care finder will vary depending on the complexity of the person's needs. For example, it may take considerable time to build rapport and trust with some. Some people may need significant support to connect with the services that they need. Some people may need more frequent high-level check-in support than other clients. The time between reassessment and navigation to new services or providers will vary. Care finders will undertake assertive outreach to proactively identify and engage with people who fit within the care finder target population. Assertive outreach includes reaching out into the local community and actively identifying and engaging with potential clients, including through direct contact and support contact via intermediaries such as health professionals, aged care and disability sector professionals, and people within the community and voluntary sectors. It will also include exploring and establishing different ways to effectively engage and build rapport with clients. This will include adapting their style of working to suit the individual needs of each person. They'll also meet people in their own environment, such as their home or other environments familiar to them. And where needed, care finders will connect with people over a number of occasions, building a relationship prior to providing support and accessing aged care. Care finders will also be responsible for building, maintaining, and leveraging networks and ensuring that these connections and networks in the local community support the identification and engagement with potential clients. There will be times when older people are scheduled for an assessment or service commencement some weeks in advance. During these times, care finders will periodically contact the person to check how they are overall, to ensure that they understand the next steps and that they know where they are in the process. They'll also check in to see if they need support to remain engaged in accessing services and whether their needs have changed or if they have any additional need for support from the care finder. Obviously, the support will vary depending on the circumstances and preferences of each person and the complexity of their needs. For example, this may vary based on the time between assessment and service commencement, the level of support a client needs to remain engaged in accessing services, or how quickly a client's needs are changing. So earlier we talked about a high-level check-in. So what is a high-level check-in? Why are they important? And how and when should they be conducted? A high-level check-in is a phone call or a visit to a client to ask and to determine how they're doing, whether the services in place are still meeting their needs, and whether they have any need for support from the care finder. A high-level check-in should occur within the first 2 months of service commencement. The frequency of additional high-level check-ins should be agreed between the care finder and the client, and will depend, as we've said, on the individual circumstances of each client. For example, some clients may only need one high-level check-in a year, or may not need ongoing check-ins if they have ongoing support, such as a social worker. Some clients may need more frequent, such as quarterly, high-level check-ins in the first year of service commencement, and this could be followed by one high-level check-in a year thereafter. Some clients may need frequent high-level check-ins throughout the year to ensure they're still receiving services and their needs are being met.
So care finders are responsible for providing intensive navigation support, but their functions do not include coordination of aged care services. So we know that providers are responsible for the day-to-day management of a client's care needs, including care coordination of services and management of changes to the client. The care finder role may involve discrete elements of individual advocacy, for example, support to resolve a problem with a provider that the care finder has helped the client to engage with. Individual advocacy is not a primary role of care finders. People requiring individual advocacy and support or mediation should generally be referred to the older person's advocacy network. However, to ensure a more seamless and consumer-focused approach, care finders may provide clients with advocacy support where the client wants them to and where the care finder has the skills to provide the advocacy support. If this is not the case, care finders will provide a warm handover to OPAN for advocacy support.
We'd now like to provide you with some reflections around target audience eligibility. We'll present some scenarios and we'd like you to consider whether these people would fit within the criteria. Layla does not speak English and is being cared for by her daughter, Isha, who speaks English. Isha does not feel confident to call the My Aged Care Contact Centre in order to find out more about aged care or to set up an assessment. And the second scenario, Chen is seeking independent advocacy to help him make choices about receiving aged care services. In the first scenario, Layla does fit within the eligibility criteria and is part of that target audience. In the second example, it is likely that Chen is best referred to OPAN because they provide advocacy services, and as a general rule, care finders do not. In our next scenario, Rob has a hearing impairment and prefers to speak with people face to face because he finds it difficult to hear over the phone. He is also comfortable going to a Services Australia centre to find out more about aged care, to set up an assessment and to take part in a virtual call with assistance from an Auslan interpreter. In the next scenario, Chris has cognitive impairment and no family or close friends who live nearby to help him through the screening and assessment processes. while Rob has a hearing impairment, with the right supports in place, he is confident and capable of inquiring about aged care services and setting up his own assessment through My Aged Care. However, with Chris, who is living with a cognitive impairment and no close family or friends nearby, the assistance of a care finder would be vital in helping Chris navigate that process. In the next scenario, Emilio doesn't speak English, but has given permission for his son Tony to be his representative. Tony is willing to support Emilio to call My Aged Care with the help of an interpreter. He's also able to attend the assessment with an interpreter and talk to providers with an interpreter. And in the final scenario, Jess is uncomfortable with engaging with government, resources and departments due to past discrimination and trauma. This could be connected to a history of homelessness, identifying as part of the LGBTIQ+ community, a forgotten Australian, or a care leaver. Jess's partner feels the same way about accessing help. In the first scenario, Emilio is happy to give Tony permission to act on his behalf as a representative, and therefore would not need the assistance of a care finder in this example. However, in the last scenario, Jess and their partner both have similar feelings of distrust and are less likely to engage with government services, so therefore a care finder would be essential in building rapport and enabling Jess to feel comfortable to go through the My Aged Care process and have an assessment.
Care finders will provide support to older people in the place of their choosing. This might include the client's home or other environments familiar to them, such as a cafe, a local library or a park, or they may prefer to meet at the care finder's office. Interactions will predominantly be provided face-to-face, but of course there are many times when providing support by other channels such as phone, video call, email, or by mail is more appropriate. For example, if this is the client's preference and the client does not have barriers to using these channels, these alternative approaches may be appropriate for consumers in rural and remote areas where face-to-face support may not always be possible. Care finders will work with older people to support them, and we wanted to share a short video about how this approach might work in practice.
Ying is a care finder and has established an ongoing relationship with Peng, who needs assistance. Ying seeks Peng's permission to become their agent in the system. The agent relationship enables Ying to have visibility of Peng's client information so she can help her access the services she needs. As an agent, Ying does not have any decision-making power. From October 2022, Ying, operating as an agent for Peng, will be able to do the following: initiate and create an agent relationship with Peng in the My Aged Care service organisation portal. Peng would need to either provide her consent to activate the relationship, or Ying would be able to indicate verbal consent. This would be used in scenarios where the client is unwilling or unable to talk to My Aged Care. Ying is able to register Peng as a new client within the My Aged Care service organisation portal, or register Peng as a client and initiate an agent relationship via the Apply for an Assessment Online form on the My Aged Care website. Ying is able to view and update Peng's information from the My Aged Care service organisation portal by talking to the My Aged Care contact centre. Ying can also receive or access information about Peng's progress in My Aged Care. Ying can also facilitate and enact decisions made by Peng about her aged care assessment and referrals for services. And finally, Ying can be the primary point of contact for Peng. So how will people access care finders? Will they need a referral? These are some of the questions that you're probably asking. And as you can see, people will not need a professional referral to access care finder services. It is expected that the majority of people will access care finders via an intermediary, such as health professionals, aged care and disability workforce, and people within the community and voluntary sector organisations. Others may be referred by staff in the healthcare system, such as an aged care assessor and the My Aged Care contact centre. Alternatively, the contact may be the result of an assertive outreach and an engagement through rapport building undertaken by care finders, as we've discussed earlier. And of course, some people or their support person, family, or representative may directly approach a care finder organisation for support. Ensuring that older people are connected with the most appropriate care finder in their area is important. Primary health networks will be responsible for determining how to best coordinate referrals to care finders in their region based on local circumstances. We don't know yet what this will look like in the Eastern Metropolitan region of Melbourne, but it makes sense that where possible, if a person is at risk of homelessness, they would be connected with a care finder who specialises in supporting people who are homeless or at risk of homelessness. If the older person is from a culturally or linguistically diverse background, that they would be connected with a care finder who speaks their language, if one is available, or has a good understanding of cultural differences and backgrounds. Or if the older person identifies as a care leaver or forgotten Australian, that they would be connected with a care finder who has particularly good connections with care leaver and forgotten Australian organisations. Alternatively, if the older person has a range of diverse needs, the referrer might direct the older person to a care finder for whom the person be most likely comfortable with based on their specific needs and requirements. It is important that the referral pathways for the Care Finder program are embedded into the local aged care system. You can help embed these referral pathways by establishing local partnerships and relationships with care finders in the region. It will also be important to raise awareness of care finder services through your newsletters, pamphlets, and social media. And this could include a specific focus of the care finder target population and care finder services available in the region. Or you might want to provide a forum through team meetings for care finder organizations to share their local experiences and lessons learned in relation to referral pathways.
Primary health networks are responsible for establishing and maintaining care finder networks. In the Eastern region, this will be the East Melbourne Primary Health Network, and the process of establishment is expected to be completed by the end of 2022. So commissioning for the program will be tailored to meet local circumstances. So it will take into account the local population, demographics, and identified needs. So PHNs will be responsible for establishing and implementing quality and continuous improvement aspects of the program, including processes to meet data collection and reporting requirements, supporting the integration of the network within our local aged care system, and identifying and addressing opportunities to improve integration between health, aged care, and other systems at our local level. In addition to care finders, other supplementary intensive navigation support will include the Trusted Indigenous Facilitator program, which is expected to be available nationally from early 2023. So the Royal Commission into Aged Care Quality and Safety recognised and acknowledged the lack of culturally safe care and the ongoing trauma and social and economic disadvantages that contribute to the older First Nations people and their willingness and capacity to access a complex aged care system. They recommended that the new aged care system make specific and adequate provisions for the diverse and changing needs of Aboriginal and Torres Strait Islander peoples. Trusted Indigenous Facilitators will be located in Aboriginal controlled health services, Indigenous aged care providers, or community hubs, and they will support any Aboriginal or Torres Strait Islander person who needs support. So a workforce of around 250 Aboriginal and Torres Strait Islander staff across Australia will provide this trusted support. So older Aboriginal and or Torres Strait Islander people who are within the CareFinder target population will be able to choose whether to receive support from a CareFinder or a Trusted Indigenous Facilitator, or both if available. Implementation of this program is being led by National Aboriginal Community Controlled Health Organisation with their statewide partners. Some existing programs currently provide navigation support as part of their service offerings, although this may not be their main focus. So these may, in fact, also be services or programs that CareFinders would access or on behalf of a client refer clients to. For example, the National Dementia Helpline, which provides a range of supports to people living with dementia and their carers. The Older Persons Advocacy Network, which supports people who are receiving or seeking to receive aged care, and they provide support around resolving disputes, advocacy or complaints. And of course, the Carers Gateway, which provides free services and support for carers of older people. So we wanted to share a short video with you to demonstrate in practice what a client's experience of using a CareFinder service might look like.
Flavia works as a CareFinder. Part of her role is undertaking assertive outreach activities. This means she goes into the local community and actively identifies and engages with potential clients and their families. Today, she's at a local shopping centre. Flavia notices Antonio is paying special attention to their information brochure and offers to answer any questions he might have. Flavia learns that Antonio is 71 and has been living in Australia since his early 20s. He's been living alone since his wife passed away 2 years ago. As the discussion progresses, Antonio says, "I don't see my boys much anymore. Don't see many people. Getting to the shops can be the highlight of my day. Sometimes I just sit and watch people go about their business." Flavia talks to Antonio about the many social and community groups within the local area, but Antonio says, "I need to be careful with my money. I'm on the pension. I can't spend money on activities. And where would I go or what would I do? I wouldn't even know where to start looking." Flavia tells Antonio, "My role is to help people find activities, social groups, health services, and support at home so they can remain independent. If this sounds of interest to you, we could talk more about it and see how I could help." Flavia and Antonio agree to meet the following week. Flavia meets up with Antonio and they chat about what's happening for him in his life, what's important to him, and if he has any concerns. Antonio tells Flavia he gets lonely and bored living by himself. He also says that the rent and cost of living is a concern. Flavia talks to Antonio about the services available to him and asks if he would like help to get connected. Antonio agrees. Flavia supports Antonio by describing the registration and assessment processes and discusses the types of questions that will be asked when they register him with My Aged Care over the phone. At his request, Flavia sits with Antonio for support when he calls My Aged Care. She also asks him if he would like her to attend his in-person assessment, which he agrees to. Antonio is assessed as being eligible for domestic assistance, dietetics, physiotherapy, and social support. Following the assessment, there are still additional areas Antonio needs support with that are outside the aged care sector. After some discussions about his financial situation, Flavia helps Antonio complete his paperwork for applying for social housing, and together they meet with Services Australia to check that he is receiving the right amount of support and rent assistance. A few weeks after Antonio's services have started, Flavia calls him for a high-level check-in to see how things are going. He says most things are okay. He's learnt more about food, but he doesn't want to go to the social group anymore. He'd rather stay home. Flavia suggests they meet to discuss the situation and find a solution. When Flavia meets with Antonio to provide follow-up support, she learns that he didn't like the activities the group did and hadn't found anyone that he had anything in common with. Flavia asks if he would like to discuss this with the coordinator at the group, but Antonio isn't interested. She asks if he would like to look for a different group to join that might suit him better, which he agrees to.
We've also provided a couple of additional written examples which illustrate the CareFinder activities from the client's perspective. Again, we encourage you to pause this video and take some time to review the case studies to support your understanding of the role of CareFinders.
This somewhat busy picture provides a summary of what we've discussed in quite some detail today and includes the type of access and navigation support available post-January 2023. It also includes the target audiences and the roles and functions of each support. We encourage you to access further information about the supports via each of the program's websites. General access to aged care services is provided through the My Aged Care website, which has more than 4.2 million visits a year, and the contact centre, which receives around 1.5 million calls a year. It also incorporates 80 aged care specialist offices located within Services Australia. An additional 4,000 clients per year will be assisted by a case coordination staff located in the My Aged Care contact centre. It is expected that intensive navigation supports will be provided to upwards of around 98,000 clients through both the CareFinder program and the Trusted Indigenous Facilitators.
So we've mentioned a few times that CareFinder services will commence from the 1st of January 2023. This includes the ACHA providers who are also contracted as CareFinders. There will be an establishment period between the 1st of January 2023 and April to enable CareFinder organisations to recruit, train and establish their programs. It is expected that services will commence no later than the 31st of April 2023, and clients will be able to access CareFinder services at that time. So in summing up, we would really like to encourage you to familiarise yourself with the access channels and the navigation supports that are going to be coming into effect. So obviously attending this session is the first step, but you might also want to review the CareFinder policy guidance document that has informed this session. An important responsibility for all organisations is to ensure that all of your staff are trained and supported to be able to identify and support older people who may require navigation services. This should not be limited to assessment staff, but should also include other staff. So consider a social support client who may require additional services, but is not comfortable to navigate those services. So direct care staff are in a really great position to recognise client changes, and they should also be in a position to connect older people with different areas of our system. The final thing that you can be doing is to establish connections with the care finders appointed in our local area once these are known.
So you're probably asking where to access further information. Well, you've done the first bit by logging on and joining this webinar, and we really encourage you to share it broadly within the sector and with other colleagues, so you can all be across the changes coming. The department has also released the Care Finder policy guidance for primary health networks, much of which has informed this presentation. And you can read or view the report on the Department of Health and Ageing website at the address on your screen. No doubt, as the commissioning process takes place, we'll be able to share more information about the providers of these navigation services. We'd like to thank you for accessing this session today, and we strongly encourage you to access the great range of learning resources available on our website. These include additional free-to-access online videos, podcasts, and reading materials. And finally, these are our contact details, and we encourage you to get in touch if further support is required. We look forward to the commencement of the Care Finder program here in the Eastern Metro area of Melbourne, and we look forward to working with the new Care Finders and supporting the rollout of the program. Thank you.